ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ ਸਾਰਿਆਂ ਨੂੰ। ਅੱਜ April 6th ਹੈ। ਮੈਂ ਤੁਹਾਡੇ ਸਾਰਿਆਂ ਨੂੰ ਇੱਕ ਹੋਰ update ਦੇਣਾ। Many of you have heard of the increasing cases of COVID-19 that have been happening in the province. I wanted to tell you all that we are not at the most critical point yet. So the worst is still yet to come. So it's very important that everybody understand what we are potentially dealing with here. The other day there was, I think in the last couple of weeks, we have had a 30-year-old relatively healthy male with some underlying asthma and a young woman in her 20s pass away. This is an unpredictable disease. We have seen that this virus is very strange in how it behaves, in that though it primarily impacts those who are elderly and immunocompromised, people have noted since this started in China that every once in a while it hits a young person really hard and they get really sick. So everybody needs to take precautions now. And the reality is that what you do is going to impact your neighbor and their family, and your actions have a significant impact on how this is going to play out. There have been some models that have come through in Calgary, and I wanted to tell you some of the numbers because I think this is really important that you know. If this goes where it potentially could at some point at the end of April and May, or in the beginning of May, we could have approximately 4,100 people hospitalized in Alberta. Of those, some models are predicting 1,400 in ICU. Currently, we have just over 500 ICU beds in all of Alberta. By the end of April, we're hoping to have about 925 ICU beds. That is not enough for 1,400 people. So what is going to happen is, if you need intensive care, that means that you cannot breathe on your own. That's what this virus does to you. It takes away your ability to oxygenate yourself. It takes away your ability to fill your lungs with oxygen, essentially. If you cannot do that, you're going to end up in ICU. That means that you're going to have a tube in your throat. However, if people don't start being responsible, there might be a decision that has to be made to decide who gets that ICU bed. Okay, who gets the opportunity to try to improve their lungs, to try to heal from this. Otherwise, those people who do not get the ICU beds are likely being committed to death. This is really serious. Okay, so I need you to remember those numbers, and I need you to remember that it's not too late, that you all still have the opportunity to make some change here and make some smart choices. It is very important you stay at home as much as you can. If you have to go somewhere, you must wash your hands. You must maintain distance from those around you. Okay, don't touch your face. Protect those people that are elderly. Be kind to the people that are around you that are trying to isolate and are perhaps alone. Ask people if they need groceries if you're going out, and drop it off for them. Reduce the number of people going out. Don't take your children grocery shopping with you. The least amount of people that can be out there, the better. Call people, FaceTime them, try to maintain that social interaction, because the reality is that we are just starting. This is going to get worse before it gets better, okay? My prayers are with everybody, and we are all in this together, and we will get through it together.